Hi, everyone. Right. Let me get set up and then we'll get going. All right. Let me put the chat up here so I can see it. Quick question, guys. When I'm moving the mouse, do you guys see it? Either give me a thumbs up, thumbs down, or put it in the chat. No. All right. Let me try this one. No, that wouldn't work. All right. Okay. It's not working. All right, you guys see it that way. How about now? Okay. All right. So I'll just use this. Yeah, it works. Okay, because it distracts me, I'm gonna turn off my camera. So I can see you guys. It's funny, it distracts me whenever I see myself. Like I make a move and I'm like, okay, did somebody ask a question? So it distracts me. So I like to turn it off. Okay, guys. So our last meeting together, I am recording it. So you will have the recording once it's available on your Canvas. Our test is exam 6 is going to be Monday. We will meet at 11 in our regular classroom. The exam style is going to be exactly like the exam 5 with regards to diseases. So multiple choices in all of the cases. And then you will also have case studies, okay? So you are a bit more familiar with the pattern and the type. This time, hopefully it will help you guys. Again, stick to the PowerPoints with regards to the amount of detail that I want you to know, the type of diseases that I want you to know. And best way to study for it is quizzing one another, paying attention to specific signs and symptoms or the sources of the disease, transmission methods and things like that, okay? All right. all of the practicals have been graded. I think I finished, I think so, for your class, grading all of the unknown reports. If it was submitted, I graded it, unknown reports and the lab reports. So the grades are there. If it's something that is a lower than the grade that to total points, either I put Y in the, if it was submitted online. If you submitted it personally, I probably made notes on it in what you've given me, which I'll bring with me on Monday to give back to you guys. In this, I still have not received the final list of the students that are associated with me and finished the class. They will send it most probably tomorrow or Friday, so or during finals week. So once that's there, again, I'll put it in. And I'll tell you guys this, or remind you on the exam day too. Once I've finished grading every exam and everything, I will put an announcement on the Canvas telling you guys that everything's been graded. So asking you guys to go through and check everything. I will round up the final total grade. So for example, if you are 89.6, I do round it up and that becomes 90. So all grades will be round up. So if it's like something like that, but if it's 89.3, no, it rounds up to 89. So I will follow the rounding up rules. So 89.5 and below remains 89, 89.5 and above. I think we assume 5 will round up to, Excel does it. So I follow those rules. All the extra credit, everything has been done. So you have time. If you did not do INDES and you still want to do the extra credit paper, fine, you have time to do that. But after that, this is how we do it. I cannot change grades or do anything extra, no retake for exams, anything like that. All right. Having said that, any questions for me? Okay, so let's get started with our final chapter. It's the fun chapter. We're finishing it with a bang. So the urinary tract and reproductive system, or urogenital tract, because in most cases they are connected. Again, you don't need to know the anatomy physiology part of it. I will present each of them to you separately. In this case, there is differences between males and females in regards to both of the systems. So first, let's start with urinary system. Urinary system for both males and females, the main component or tissue is the kidneys. The kidneys' job is to remove waste products and remove the waste and basically clear the blood from waste, any other toxins, anything that is not supposed to be there. And then once in the kidneys, urine is produced. Urine is passed through ureter, and then from ureter is collected in the urinary bladder. And for both males and females, it is released via urethra. Now, the difference here between males and females is the length of urethra. So in females, urethra is much, much shorter, whereas in males, it is much longer. And it is also for males, this is the same urethra is shared both for excreting urine, and then also this is the same site for release of semen. Okay, so they share that for themselves for the reproductive system. As far as, so these are the things I want you to know. As far as the normal flora, pretty much for both males and females, up to urinary blood, urethra can be a site for normal flora, and the normal flora typically is most often the same as normal flora that you find on the skin. As far as protective measures, mucous membrane in all of the areas, secretions, mucus secretions, the enzymes, protective enzymes that they may have, like lysozyme. And then in addition to that, urine itself is acidic, so that provides, and some salts in it, so it provides a hostile environment for many microbes. And the flushing action of excreting the urine also can clear urethra. Let's see. So we talked about those. Reproductive system, obviously, major difference between males and females. So looking at males, the main component is the testes. Testes are the site where the semen and sperm is produced, and the semen is the sperm, in addition to lubricating fluids and other material. So that's where it's produced. And the site of ejaculation is urethra, where the semen is released. As far as the flora, you only find it in urethra. So the penis, again, same where the urethra is for males, and then also the site of ejaculation. You find it not only on the surface of it, but then also in urethra. Here, there is a big difference between circumcised males versus uncircumcised individuals. The reason is uncircumcised penis has extra fold on of skin at the tip, where it basically can fold, and within it hold a large amount of flora in the folds, and they have a chance to grow and increase in number, whereas a circumcised penis, no, typically it's much easier, cleaner, and not cleaner, but it's easier to keep it clean. The other thing is the folds can create a what am I looking for? Anaerobic environment. So in the folds, oxygen can be limited, and it can create anaerobic environments, therefore allow for anaerobic bacteria to colonize and grow, which in most cases, they can cause more severe infections. All right, females, the ovaries are where basically hormones and all of that are produced, and where basically after menstruation happens, puberty, they start producing one single egg every month in most normal cases through the follicles. The egg then is, funny enough, ovaries are detached almost from the uterus, but they are very close to the fallopian tubes, and via the fallopian tubes, the egg travels through the uterus, and usually fertilization happens along the fallopian tubes, and then the fertilized embryo goes and transplants on the lining of the uterus and creates a placenta and all of that. The opening to the uterus is closed by cervix, and then the opening to the uterus where it's open is the vaginal or vagina. Now, for females, major defenses is the mucous membrane of the reproductive system. And then also cervix can provide some protection. You do have the vagina is where you find the normal flora. Cervix and above should be clean. Depending also, secretions of the vaginal tract provide some protection. The flora that you have in the area is very similar, again, to the flora that you can have in the urethra of females, but in general, on the skin, because it's pretty open, it's any flora that you have on the skin can actually be found in the area. The other protective measures for females is, interestingly enough, so the type of secretions that they have before in the childhood, during normal or after menstruation, and while menstruation continues, and then after menopause. The secretion of the vaginal tract changes, the pH, the environment changes, and with that, actually, some of the normal flora changes in the area too. So, again, there is a difference between pre-puberty and post-puberty and post-menopause in females' vaginal tract. All right. First, let's look at the urinary system, and I'm only going to look at the bacterial diseases of urinary system. One bacterial, typically that's the one that we all worry about. So UTI, bacterial urinary tract infections, UTI. So UTIs can happen in multiple scenarios. It can happen on its own due to hygiene issues. It could happen to a person that is hospitalized and cannot take care of themselves with regards to hygiene. Catheter can actually introduce it into the urinary tract. Sexual activities actually increases the chances of it being introduced. Sources are typically predominantly are endogenous bacteria. Endogenous bacteria means these are your normal flora. E. coli tends to be the dominant case because that's one of the most common ones that we have in our GI tract, and not even most common, but it's the highest in the number of them in the GI system. And the endogenous bacteria, typically the source or where they are is the colon. So it's GI system. From there, it can travel to the UTI, urinary tract, and become a UTI because this is not their normal site. So therefore, they will start growing and causing issues. Other things can increase it. Again, type of underwear that you wear. So G-strings, for example, for females, very common, can actually allow for transport of bacteria much easier from the GI and colon region to the urethra. So manifestation. Typically, if it's urethra, just urethra, what ends up happening is there is burning during urination, there is itching issue problems because it stimulates the neurons in the urethra. The constant feeling of the need to excrete and go and relieve yourself is there. If it passes, and then same thing, it goes to the bladder, cystitis, again, same thing, probably maybe abdominal pain, slightly discomfort, enlargement of lymph nodes, the inguinal, the groin region, lymph nodes, enlargement. And sometimes in the urine, you can see blood, a little bit of blood, because as it irritates, it can actually damage some of the cells, a lot of white blood cells, and hopefully you can see the bacterial source. If it progresses, and if it's not taken care of, it can progress to kidney infections, and then obviously the signs and symptoms become much more severe: fever, pain in the back and the sides where the kidneys are, definitely blood in the urine. And if it again progresses, kidneys can get damaged. From kidney can get to the blood, become systemic. So all of those possibilities. So it's very important to take care of it. UTIs can become very complicated very fast, especially in immunocompromised and elderly. It has to be taken care of with regards to elderly, especially in immunocompromised. So it can become problematic and become complicated. Also, one interesting fact, sometimes people think they have a bladder infection or UTI, and then they are told, no, you're okay. Some of the neurons in the area, especially hemorrhoids and all of that, can actually stimulate the that neurons that are near urethra. So you don't have the burning or anything, but you have that sensation of wanting to relieve yourself and urinate. And people always think, oh, that's UTI, but it's not always. So signs and symptoms, we talked about it. Susceptibility, females are more susceptible than males because urethra is much shorter. The opening to the urethra for females is much bigger, much easier for the transfer to the area. Diagnosis, signs and symptoms, they do a urine test, and they are told now by CDC to do a sensitivity test for the bacteria that causes it, because UTIs are becoming resistant to some of the common ones that are prescribed. And again, treatments are antibiotics for it, and some preventive measures women are told to, in some cases, like maybe hormone therapy sometimes can cause, again, a different pH in the environment that allows for the growth of these endogenous bacteria. So maybe check their hormone therapies that they have. Some practices, they're told not to have cranberry in the cranberry juice. There is actually a type of an enzyme that changes the pH of the lining and provides some protection for it and makes it hostile for bacterial growth. Things like that. All right. Now we're switching to the reproductive system. Again, if you have any questions, anytime, stop me or put it in the chat. I keep looking at the chat to see if there's a question there. Okay, reproductive system. We're going to look at it two ways. Non-venereal diseases, so non-STIs. Non-venereal means not transmitted usually sexually, okay? Versus we're going to look at venereal or STIs. These are type of infections that mainly source of transmission is sexual intercourse. Staphylococcal toxic shock syndrome, bacterial vaginiasis, and candidiasis. Interestingly enough, you see, most females. So males, again, because of the penis having a very small opening and the longer urethra, for them, it's getting just infections of the reproductive system, non-sexually transmitted, is very rare. First one, many females have heard of this, especially when, upon menstruation, they've been told on this. Any feminine products has this on it. Staphylococcal toxic shock syndrome. If you recall in immune system, when I had the animation for helper T cell activation, they started talking about super toxins. This was it. So certain groups of Staphylococcus aureus, they produce a toxin. This toxin, what it does, it goes and on the outside attaches to the T cell receptors and the CD4 receptors and stimulates them and forces them to become active. When they're not supposed to become active, they're not responding to an antigen presenting cell. They are just responding to their T cell receptor being attached to an antigen on a non-antigen binding site. Still, it stimulates them. So they produce a large amount of cytokines. That large amount of cytokines starts the inflammatory response, non-specific response, which in turn then causes an inflammation, severe inflammation throughout the blood where it's not supposed to be there. So the Staphylococcus aureus grows in the vaginal tract that produces the toxin, and the toxin is picked up by blood and your fluids. So it causes a severe inflammation, very high fever, because your lymphocytes are producing a lot of all these cytokines that causes fever, vomiting, rash. This is what the rash looks like. It looks like you have a sunburn. It looks like you have a major burn all over. Sore throat, all of that, again, because your immune system, your inflammation becomes fully active. How it can get passed on, the susceptibility, it has to do, obviously, as you start the menstruation, the lining of the vaginal tract is already kind of inflamed because of uterus wall, basically, before menstruation is getting ready to accept a fetus and basically help it to grow. Once pregnancy doesn't happen, that uterus wall is going to try to get back to normal. We call it the shedding. It's somewhat, and basically all of that causes the inflammation in the area. So the vaginal tract is already inflamed and the barriers are kind of vulnerable. So anything like tampons can do this, using sponges for diaphragm, all of these different douching, some of these can actually add to the irritation. Women who had just had a baby, the vaginal tract is very inflamed. Intercourse during that time can actually introduce the bacteria again and cause it. Treatment, supportive. You start with giving anti-serum for the toxin. You want to neutralize the toxin, and then, of course, simultaneously giving antibiotics to get rid of the bacteria. Okay, next one, bacterial vaginiasis. So this is inflammation of vaginal tract and infection of the vaginal tract. Many bacterial causes, most common ones that they see, Gardnerella vaginalis and Mycoplasma hominis. So these are some of the two common ones that they see in people. Again, it's found in the environment easily and it gets into the vaginal tract. And many times, again, does not have to be sexual. Douching is highly associated with this. It can transfer to the vagina. Again, use of tampons, sometimes intercourse, but then again, all these can increase the susceptibility of the individual getting it. Diagnosis is, first of all, symptomatic, the signs and symptoms, irritation of the site, burning of the site, itching, and then the inflammation of the vaginal tract causes the discharge. This is a white, very white discharge with odors, fishy odor. So it's the bacterial odor. And diagnosis, they take a sample and they look at that under the microscope when they stain it, and these are the clue cells. So epithelial cells of the vaginal tract, okay, healthy, this is the healthy one, and then clue cells. So they are completely covered with bacteria all over. So that's a clue cell, where you see like this one is one of the best ones. So you're seeing all these other white blood cells too, and then you see epithelial cells, and then all of these bacteria growing on it. So that tells them there's a bacterial infection. Treatment, I don't have the treatment on it, but obviously, you know, the treatment is antibiotics. And it should be treated. In most cases, it might go away, but it should be treated in order for it to go away fast and not cause other issues and penetrate cervix and get to uterus or fallopian tubes. Candidiasis, this is, again, mostly females. However, males can have it too. This is what we refer to as yeast infection. Males can have it, but in their case, they can be asymptomatic. So they can actually, a guy can get it from a female or vice versa. The cause is one of our normal flora, Candida albicans. For whatever reason, it in the vaginal tract, it becomes predominant, starts growing and increasing in number, overtaking any other normal flora. This causes a white curd-like discharge, again, severe burning in the area, burning during urination, having the sensation that you want to urinate constantly, painful intercourse, and so on and so forth. Many times susceptibility is, for whatever reason, the pH of the vaginal tract changes, or antibiotic treatments can also do that. The pH change, sometimes women can get this when they are stressed. Other things is the environment. So making sure that, after urination, the area is cleaned, it is dried out. So extra humidity and all of that can increase and allow for the fungus to grow even better and better. Treatments is antifungal drugs. Antifungal drugs, usually topical. In some cases, they can actually give you systemic antifungal, but the topical one, so this is like Monistat and all of that, that you can purchase even without any prescription. Prevention, making sure the area is clean, dry. If you have antibiotics, take normal probiotics that can help, consume things like yogurt. They have a large group of probiotics or flora that helps with reimplanting the normal flora. Okay, now we're getting to the fun ones. Sexually transmitted diseases. Oops, I should change this. Sorry. We no longer call them sexually transmitted disease. We call them STI. The disease is actually it has been told that it's offensive. It's not. It's an infection. So the use of term of disease in case of with regards to sexually transmitted ones, it has become offensive. So we use STIs, and I thought I had changed this, but I think maybe I thought I did. I have not. It's because this has changed a while back. So maybe I've uploaded something old. Okay, I'll change it and put the new one. So it's actually STI. We don't call it STD anymore. Or venereal diseases. We're gonna here in this case cover bacterial, viral, and protozoans. And in this case, men and women can get it too. So, first one of the most common ones in United States, gonorrhea. Neisseria gonorrhoeae, gram-negative diplococci, is the cause of it. So the gonorrhea bacteria, it's known, Neisseria gonorrhoeae and gonorrhea. The disease is also out there known in the streets as genitalia, as CLAP. I don't know why I'm reading that. They call it CLAP sometimes, or drip. So it's in the streets, it's also known as CLAP and drip. The reason it's called one of these, like especially drip, it's because of males, the symptoms that males have. So you have an image here. That's the secretion of a yellowish discharge, continuous secretion of a yellowish discharge from the penis. Males do not, they're totally different than females. Females always have a discharge of some sort or not through their reproductive system, but males do not, okay? So this is a, basically that's why they call that. It can, with all of the sexually transmitted diseases or infections, I'm mentioning it here, but sexual intercourse and sexual activities can take many different forms, all right? So oral, normal ones, or not normal ones, the genitals, and then also the anal ones. So because of that, you can have it in the genital tract, you can have it in the mouth, gums, it can manifest itself there, the anal opening, all of that, it could show signs and symptoms. So I'm mentioning it here, keep that in mind. Symptoms about And one of the reasons that it can be actually passed on easily, and it's one of the predominant ones in the United States, is because 30 to 60% of individuals, both males and female, can be asymptomatic and not have symptoms for a long, long time. If they have symptoms, most of the time the men see it. Females are, in this case, the ones that typically can be asymptomatic. Males usually have painful urination and the discharge. Women can have some unusual discharge, that it's bloody, spotting in between menstruation, a little bit of difficulty urinating, but other than that, these are it. So not much. It can lead for females who have that infection if they go through labor and a child is produced, or they give birth to a child through the vaginal tract. It can actually, this is the one that, remember, we talked about it way back when we were talking about antimicrobials, can cause the blindness. So ophthalmia, neonatal, this is the gonorrhea gets in their eyes and causes scratching. Treatments, antibiotic, penicillin derivatives, tetracycline, so a lot of them could affect it and responds to it. However, a few years back, CDC basically sent out an alert. There are some strains of gonorrhea that we're finding that are resistant to antibiotics. So CDC basically has requested that everyone to go through a sensitivity test and be prescribed specific antibiotics that treat that infection the best, in order to reduce the spread of resistance. It has to be taken care of, and unfortunately in females, if it's not taken care of properly, it can go further. Same thing as we talked about as vaginitis, infections of the vaginal tract, bacterial infection. It can go further, go up to uterus, and then from there to fallopian tubes and cause damage to the fallopian tubes. This is called pelvic inflammatory disease in females. We'll talk about it at the end. Syphilis, this is number 2 bacterial STI in United States. Treponema pallidum, this is a spirochete. So it is a spiral bacteria. So this is the first time that you've seen them as spirillum formation. They are gram-negative, can be found in anyone who is sexually active, multiple sexual partners, sexual workers, all of these STIs. Drug addicts, because in order to get their drugs cheaper and faster, they are forced to do certain things. So obviously it can be passed to them. So syphilis, interesting, comes in few stages. There's primary syphilis. It causes sores that are painless with a hard border. So when a person has it, the pain is not what alerts them to it, is this sensation of a hardness of the borders. They can sense it. It's called a canker. The sores, again, can be found anywhere, last 3 to 6. What makes it difficult to diagnose is the location of the canker. If it is somewhere that it's not felt or is not seen, they wouldn't know that they have it. Then they don't do anything, goes to secondary syphilis. Secondary syphilis can have a rash, not always, and the rash is all over the body, including the bottom of the feet, sole of your feet, and the palm of your hands. Sore throat, headache, so kind of like a cold symptom, flu-like symptoms. It can travel to all the other areas, and could last weeks to months, okay? At all stages, primary and secondary, they are very infectious. Then we have latent syphilis. So the third stage funny if they still don't do anything from the secondary and all of the signs and symptoms go away, if they will go away, then there's an area that they think, oh, okay, I'm fine. There is nothing going around. Whatever I had, I'm cured now. And that's latent. It can last up to 10 years. And finally, it goes to tertiary syphilis. That's when it comes and reactivates and it got into the blood. From blood has affected central nervous system, and therefore can cause blindness, dementia, paralysis, heart failures, and so on and so forth. In females, it can actually be passed on to the children during birth, okay, and cause issues in a newborn. In addition, in a female, if it's around the latent syphilis, it can cause miscarriages, stillbirths, and all of that. This is, by the way, Al Capone. And it is thought that in Alcatraz, he died eventually from syphilis, okay? One thing I have to mention here, again, you guys are all trying to get to become a healthcare provider, and healthcare providers should be aware of all the social issues. You're not just a healthcare provider to one type of social standings in the United States. We are a melting pot, so we have a lot of different people. And in some cases, many of you guys are nurses, so you are the patient's advocate. You are the one who sees the patient, you are talking to the patient, you're fighting for your patients. Many times we've seen it, especially with COVID coming, sometimes immigrants, and in many cases, the Black population in the United States have an issue with trusting the medical field. One of the biggest causes for it is actually studies with regards to syphilis that happened in 1930s, late 1930s, 1940s. The study is called Tuskegee study. And I always mention it. I would never ask questions about it, but you have to understand why these things happen out there and not just put it into this is how certain group feels. So the Tuskegee was done by government and prestigious John Hopkins Hospital. A large group of Black population was taken in. A Black doctor was actually was put part of the group, and they put that person in front, and even some Black nurses. But most of the study was done by a whole group, and government was controlling it too, or was aware of it. What they were doing is they were studying syphilis and effects of syphilis if it's untreated. So they were basically giving these men treatments. The men were coming in once a week. They were taking samples. They were lied to. They were told that they were being taken care of. They provided free care for their families. Again, at all times, they were giving them these medications, which just was placebo. We're talking about 1940s. This is when penicillin came along, and they knew penicillin cured syphilis. Intentionally, they did not give it to them. Some of the members of the group went to fight for World War II, and they realized when they go into Army, they were enrolled. Army does a test and basically gave them penicillins, and they're like, oh yeah, you have syphilis, here you go, you're cured. So those group of men that were not treated, they were passing the disease to all their families, children, and all of these issues. And some of them went into tertiary, not some of them, pretty much all of them went into tertiary. This study didn't last just one couple of years. It lasted 20 years until some of the people basically started going to the media and got tired of this. The individuals who knew how they were treated before, and they learned about it, and the media basically got a hold of it, and eventually the Congress and Senate had to do something about it, and it started some of the most modern ethical, for each study, ethical processes and laws that they have to follow. But because of that, a lot of the individuals who were in the study, they died, and their families basically had other issues. So that's a source of not trusting them. This is not the only one. There were others, that poor population, immigrants, and then the Black population in the United States went through. So this is why they don't trust. They basically think that something happened. Clinton was the one that at the end of his second term, he apologized for this. And they just gave him an apology. I don't know how much of a like legal issues went through, but again, so that's one of the reasons. Bringing back, so always study the history and find out why something is happening or resistance is there in your patients. Okay, so syphilis complications, like I said, these are the complications that you see when you're not treating them. Treatment, penicillin and derivatives, miracle. Takes it away, no problem, okay? All right, so chlamydia, gonorrhea and chlamydia, they're the two that constantly compete as our STI of the United States. CDC actually believes this one tops gonorrhea because majority of the individuals, males and females, are absolutely asymptomatic. So they don't report, they don't know. Chlamydia trachomatis is the bacteria that causes it. If you're showing signs and symptoms, pain in the lower abdomen, testicles, pelvis, vaginal tract, may have some discharge, but like I said, majority of individuals, especially females, 85% are absolutely asymptomatic. Males can show symptoms 50%. One of the predominant causes for PID, pelvic inflammatory, because they don't know that they have it, women, and it progresses and the body doesn't take care of it. Nearly 1 million a year is reported. CDC thinks it's more than 3 million per year because they're asymptomatic, they don't know. They think it's 3 times higher than gonorrhea, so it's most common. Again, it responds to a variety of antibiotics very nicely and goes away. PID, so again, a little bit more, many causes. Anytime females have any of these bacterial infections, either sexually transmitted or not, if it's not cured, it can pass to the fallopian tubes and cause damage to the fallopian tubes. Damage to the fallopian tubes then can cause sterility, ectopic pregnancies, which can be dangerous and cause death. So it has to be, any of the infections has to be taken care of. If it is PID, again, they usually give the person some antibiotics, and in some cases, surgery might be needed in order to fix the sterility. Okay, viral diseases, sexually transmitted viral diseases. Again, I will make sure to change this and make it STIs, sorry. Genital herpes and genital warts. So genital herpes, this is type 2, simplex virus type 2. They say might see some type 1, this is very rare, but genital herpes, sexual genital herpes is basically, in majority of cases, just say type 2. Signs and symptoms. It starts with the blisters in the area of infection. Again, could be any place. This is what the blister looks like. It's filled with, we call it a blister, but it's actually a vesicle. But then basically it erupts, and then it starts getting better, and eventually it will go away. The herpes virus is a latent virus, and it goes into the neurons in the mucous membrane, the skin area, wherever the infection is, and it becomes latent. Unlike oral herpes, genital herpes can be shed at all times in the secretions of the genital tracts, especially in case of females, in the mucus that is in the vaginal tract. Therefore, they are considered at all times infectious, not just when you have the special blisters. So, and like I said, it could be found in any of the areas. So the blister, they just call it the genital herpes blister. The blister can be cyclic, so comes and goes, and you can have many, many months or sometimes weeks without having a blister. And then when it's gone, you think everything is okay. If it's not treated or it's not completely cured, but if it's the replication of the virus is not controlled, it can actually get from the blood, get to the nervous system, cause encephalitis and other issues. In females, it may be passed on to the child during birth. Very rare for it to pass placenta. So a female that has herpes can have a child, but again, kind of like HIV, they have to have a C-section. They have to continue taking the antiviral. The treatment is a group of antivirals that it's given to them. So the female has to take it during the pregnancy, and it's given to the newborn also for a while. The birth has to be through C-section. They should not breastfeed the child. Genital herpes can lead to cancers. Most often is cervical cancer. You can see the cancer in males too. So again, no treatment for genital herpes so far, no vaccine associated with it so far. Genital warts, again, it's human papillomavirus. There is 30 strains of it, but there is a few of them that can cause, their host is the genital tract, the vaginal tract and all of that. So they like those cells and their receptors. This is totally different strains than the warts, the skin warts that we talked about when we talked about skins. So totally different HPVs. It is one of the most common one as far as this tops herpes. So it tends to be the most common viral STI in the United States. 800,000 cases per year. Like the skin warts, it causes genital warts, just in the genital region. And then the treatment is basically removal of the warts. So all of the infected cells and maybe some of the healthy cells in the bordering area, that's how you get rid of the virus. And once it's gone, the person is cured. Okay. There is the vaccine, Gardasil. The vaccine for it is against now, I think, 5 strains, or it's modified recently. I'm not sure if it's 5 strains or it's gotten better. So, and they basically say individuals who haven't been sexually active should do that. Sorry, I just saw Mia said. So Mia, you asked how does it STI manifest in an individual? Depends on each of the diseases. Like herpes, you see the blisters right away, and it manifests that way. But the problem is if the individual doesn't know about herpes, they don't go and get help because the blisters go away and they're like, oh, okay, it was an irritation or something, an infection, I'm good. But then they can spread it. Like gonorrhea, if they are not symptomatic, they won't know, and they spread it via sexual intercourse, blood interaction. So it's typically through sexual intercourse. Does that answer your question? Or did I answer?
Thank you. I was just wondering kind of like, I don't think I worded it properly, but how do they have like an outbreak to begin with? Like what gets in their system to cause like the syphilis rash, or like how does it even start? Is it just, I don't know if I'm
stages.
Properly.
So just stages. So like a person who gets syphilis, it starts with that, primary stage, then it goes away, and the secondary stage is the rash and all of that. It shows it. I don't know if I answered it right.
Oh, no, you're good. My question is confusing, but I appreciate you answering it.
Yeah, it's just, it's not like there's that much of a difference between individuals. Majority of people will show that rash. But again, there's always that person that maybe shows all of the symptoms except for one, or a couple of the symptoms they don't show. It just has to do with your genetics, how your body reacts. Like if it's part of inflammation, many people when they get sick, not many, but there are some people that their skin is sensitive. Anytime they have an inflammation, their skin acts weird. Even it could be a simple cold and their skin is like weird. But again, it can be genetics. I hope that helps.
Okay, thank you.
You're welcome, Mia. All right. And then also, again, how it spreads and the number becomes so high, for example, in the United States. In most cases, if it's asymptomatic, they're just spreading it, and multiple partners and sex workers and all of that, they're not careful and they're not taking protective measures like using condoms and things like that. Most of the cases, condoms can actually help prevent it. Not all the time, but again, reduces the chances of a person getting it. Okay, finally, sexually transmitted protozoan disease. This is trichomoniasis. It's Trichomonas vaginalis. So as it's the name vaginalis, that should tell you. The reason they call it vaginalis for the second part of the name, it doesn't mean that only females get it. Males and females get it. Males are pretty much 100% asymptomatic, and they don't feel it, so they don't report it. In females, however, it is most of the time 100% symptomatic. They have a foul-smelling yellow-greenish discharge with severe vaginal irritation. It's a protozoan with flagellas, the 5 flagellas. So these are some of the other images that you see. So females reported, and that's why they called it vaginalysis. They thought it was first for females only, but then they realized, men get it too. So primarily via sexual intercourse, you get it. It is the most common curable in females. We see it because, again, they're the only ones who report it. Males don't. Usually once they have it, they are told to mention it to their partners and ask them to come and get the medication for it. And treatment is nicely treatable with a couple of different drugs. All right. All right, guys, this is it. We're done with all of our lectures. So go to your happy place. We're done. We finished. Let's see. Let me stop sharing. There. All right. Now I can look at you guys. Okay. So again, let me know if you have any questions with regards to the test. Our test is, again, Monday at 11 o'clock in our regular classroom. So I'll meet you guys there. Same format as exam 5. So try to follow it. Hopefully that exam helps you guys with studying for this. Any questions for me? Okay. All right, guys. Thank you for hanging in there. And I'll see you guys on Monday. And again, thanks for a fun semester. But I'll see you guys on Monday. Okay? Bye. If you have questions, email me.
Oh, I have a question for chapter 19.
Sure, Tiffany. Go ahead.
Can you explain the formation of tubercles again?
The formation of?
For tuberculosis.
Tuber cells.
Yeah,
so
tuber cells.
We call it tuberculosis, but they call those nodules tuber cells. Tuber cells, basically what ends up happening, it goes into our system, gets into the lungs, macrophages try to engulf them, and then the TB itself is intracellular. So, hold on, I'm gonna do something. I hear my own voice coming back. Mute your microphone. Okay, thanks. I hear my own voice coming back from your computer, and sometimes it gets crazy. The TB goes inside the macrophages. And since macrophages are supposed to destroy the bacteria, but they're not, and they're harboring the bacteria, what the immune system does comes and clumps the macrophages that are infected and the bacteria together And the lining of the lungs basically produces a connective tissue around them and encapsulates them, puts them in like a capsule. That capsule is called a tuber cell. And eventually, basically, when they are there, no nutrients are given to them, nothing. So that should die. And the immune system basically tries to send antibodies, all these things in it in order to kill whatever's inside the tuber cell. If the immune system loses and the tuber cell ruptures and comes out, then that causes secondary TB. Does that answer your question?
Yes, thank you.
Awesome. But trust me, I'm not going to ask you to explain something like that. If it is, it's a multiple choice question.
Okay. And then what is the causative agent for gingivitis?
It's the same oral flora that you have, like Streptococcus mutans, lactobacilli, so normal flora, and the plaque. So the plaque overgrows over your gums and causes severe inflammation of the gums.
Okay. And then in chapter 20, you said the STEC produces a protein that causes the lining on the colon to rise up and meet what?
Meet the bacteria.
Okay.
So it brings like a pedestal, causes the lining of colon to come up, and then allows the bacteria to sit on it, contact it, therefore get nutrients from it and increase in number. So it colonizes the lining that way.
Okay. Thank you.
You're welcome. Any other questions for me?